everybody, welcome to my talk today. Nursing assistant, healthcare assistant or support worker, interview preparation and questions. So if you're watching this, you've probably got an interview coming up, so good luck. That's a photo of me when I started my career 34 years ago as a student nurse with a hat on in the 1980s. And I've worked as a nursing sister, registered nurse tutor, and I've interviewed hundreds of support workers and nursing assistants over the years. So I hope you find these tips helpful. Do press like if you enjoyed the video, and it's free to subscribe to my channel if you want more videos to do with nursing careers. So I hope you find the talk helpful. So today I'm going to go through some background research that you need to do before your interview. You shouldn't really just be downloading loads of answers to questions and template answers, because that research before interview is important. You might be asked further questions at interview and you need some practical examples. I'm going to give you lots of tips of the research to do before you attend. I'm going to talk through what employers are looking for, some simple exercises to help you prepare, some example interview questions and how to plan your answers, and finally dealing with nerves, because we all have them. So first thing, understanding the role is very important, so you know exactly what you're applying for. What does a nursing assistant, healthcare assistant or healthcare support worker actually do in this role? And knowing the difference between roles of what a healthcare assistant does or support worker and an assistant practitioner or a nursing associate and registered nurse does is very helpful. So to find that out, review the job description that will be linked to the advert that you've applied for. There should be a job description and a personal specification. You can ask for an informal visit. You might ring them up if you're not quite sure on the details of the role. And you can also review nursing websites. So there's the Nursing and Midwifery Council website, NHS Careers, Royal College of Nursing, and there's lots of videos out there, a day in the life of a nursing assistant or a healthcare assistant. But do check out that job description. I've also got some helpful videos linked to future nursing careers, a video on the difference between the support worker, nursing associate and registered nurse, especially for those of you that are thinking of a future career and developing into future roles. How to become a nurse in the future and the different routes into nursing, be it pre-registration, traditional nursing degree or a more of an apprenticeship route. So do check out my other videos. So when you're applying for a role, you need to think about what you're applying for and what the specialist area or type of care will be that you're delivering. So for example, you might be in a nursing home that's linked to dementia care, and patients with dementia have very specific needs. They might be confused, and there may be many challenges when you're caring for somebody that's confused. So do check out do some research about the types of conditions and the types of care that a patient will need in that area. And what sometimes they won't use the term patient, it may be client, it might be service user. And again, it will be in the job description. And if you look at the institution website as well, that will give you an indication of the type of care you'll be delivering. Some nursing assistants and support workers will work in a clinic environment, in a hospital, and that's very different to working in an acute care environment or a rehabilitation or a community setting. So that's why it's really helpful to look at the environment that you're going to be working in. Also, is the role part-time or full-time, and what are the shift patterns? You don't really want to put yourself through an interview and then find out that they can't accommodate your childcare and that there's a lack of flexibility that you need because you've got caring responsibilities if you're a mum, for example. So try and find out beforehand by phoning up the employer, the human resources or the recruitment lead. What the employer is looking for is some key things. The first thing is that you understand what you've applied for, so you know about the specialist field, the role, and the area, the service, the employer, which is why the research before is helpful, that I've indicated that you need to do. Second thing, that you're the right person for this specific role. Do you hold the right values? So look at the NHS values and the employer values before your interview. Are you kind, compassionate, respectful and non-judgmental? If you're not, you shouldn't be going in caring for people. You may be caring for vulnerable people, and so you need to be respectful, non-judgmental in that role. Are you able to work in the environment that you're applying for? Some of them may be quite challenging environments, and the role may be physically and psychologically challenging. And they're looking to see that you can do the role that you've applied for, that you understand that it may have its challenges. They're also looking to see that you're a good communicator, that you're a good listener, and that you're patient focused. Now, that doesn't mean that you've got to be really outgoing and sociable. I mean, that's fantastic if you are, but nursing is for everybody, and you might be very quiet, calm person. Everyone's got different personalities, and there's room for everybody in nursing. So don't be put off if you're quite a shy person and quite quiet. We know we need all different types of people in roles and support workers, and but being able to listen and to be patient focused and polite and kind is very important. So are you able to work with others in a team? So collaborative and positive team working is a must. So the employers are looking to see, well, does this person come across as somebody that will work well in our team? If you observe something that's not right, you need to be able to communicate that to seniors. They also want to know that you're going to work safely and you're going to adhere to policy, that you'll access support when you need help, and that you don't put yourself or other people at risk, that you let others know if there's a safeguarding concern and you see something that you're worried about, that you go and escalate it and tell somebody, that you maintain confidentiality, and as you're going to have access to patient confidential data. And to remember that you're representing the employer at work, you've got to abide by national health and safety laws and regulations in the role. So some exercises to do before your interview is to think, so just get a piece of paper or a computer, you might prefer to type, but think about why you have chosen to apply for this particular role. What drew you to this role, this employer? And then what makes you think you would be a good healthcare support worker or nursing assistant? And just jot down some ideas. What are your current and future aspirations, and your strengths and your weaknesses? Another thing to do before interview is to write down your key values. So it might be helping, supporting others, treating people with respect and compassion, whatever your core values and key values are. And thirdly, highlight any current or past achievements that demonstrate those key values and skills that are required in the role. So have you made a positive difference to others? Are you a good communicator? Do you have examples where you've worked in a team? And it could be that you could be a school leaver, but you can still demonstrate where you've communicated or worked in a group. It could be that it's a job that you're currently in, and it could be in a shop. Anywhere where you've worked with customers, there should be some really good examples there. Are you good at problem solving or working under pressure? And as I said, draw on some examples from school or voluntary charitable work, or on current past job experience. And then Exercise 2, get a piece of paper, or you might want to type a table up, and on one side write down the key skills required for the role, and you'll see those in the job description. So it might be working well in a team, overcoming challenges, communication skills, and then on the other side link your practical examples to demonstrate each of those core skills. So think back to your own examples where you can demonstrate those skills, and then choose your best examples when you're answering questions at interview. Types of interviews and some pre-checks. Check, is it face-to-face interview or a virtual interview? How long is it? Does it include a group discussion or a value-based interview? Value-based interviews are where you'll be asked 1 or 2 questions and you'll be asked for a practical example. So for example, give me an example where you've worked well in a team, and you need to draw from a past example. So the exercises I've given you before would be very helpful for a value-based interview. Pre-checks, you need to be punctual, so always check the location if it's a face-to-face interview, and check internet connections well in advance for a virtual interview. Make sure you can see your face, and if it's a virtual interview, and there are no disturbances because you need to focus. So you shouldn't have children running around. I know people that have had to stop interviews because that person has no childcare, for example. And if you were going to a face-to-face interview, you wouldn't be allowed to bring children. So it's the same standard for a virtual interview. I would also suggest trying not to do the whole interview on a phone while you're holding your phone in front of you, because the screen will wobble around. So try and put it on a stand, or if you've got some books, try and put your phone so it's not moving around, and if you can, try and do the interview on a laptop. But I know some of you might not have laptops, which is fine to do it on the phone then. Preparing for interviews, so look tidy and smart, get your clothes ready the night before. You don't have to have any posh clothes, you can go to second-hand shops and get a nice clean shirt, for example, but you need to look clean, and don't go out the night before clubbing. You need to try and be in the best frame of mind possible to answer your questions. If you do need to cancel your interview, then email or phone as soon as possible, so that the employer is not obliged to give you another interview if you miss that date, but they're much more likely to offer another date or time if you cancel and email them or phone them before the interview. So a few more interview questions. So you are going to be asked at some stage, why have you applied for this role? And you need to really understand the role or the job description to answer that question. And you're going to sell your strengths. So if you're enthusiastic to learn, you enjoy helping others, you're reliable, a good communicator and a team player. Highlighting your past experiences is a good way to structure that answer, your aspirations and your career goals, your interests, and skills that align to the role. If you're asked, tell me about yourself, it'll be the same sort of structured answer, and the previous exercises will help as well. But if you're going to talk about yourself, also talk about your hobbies and your interests out of work. You might be mum, and that's good to sort of say that you've got these caring responsibilities and experiences as well. Another question, why have you applied to our institution? So the background research that I mentioned earlier is important to do. So you can impress them by saying you've looked on the website, that the employer has a good reputation, for example, or their core values. You want to make a difference to others. It's the type of work, the type of conditions that the patients have, the career opportunities, or it might be a convenient location. Obviously, you shouldn't just apply because it's a convenient location, but you can be honest and say that you want to make a difference to others, but also this employer is near to home and is convenient. What does a nursing assistant or support worker do? So review the background research that I mentioned earlier, so you've got a good understanding of the job description and what a support worker or nursing assistant does reflect on an informal visit or your personal experiences as well. You might have had prior experiences in other roles. What are your strengths or weaknesses is often a question. So reviewing the previous exercise I mentioned about, and if you're going to bring in a weakness, it's about knowing how to overcome and manage your weakness. So if your weakness was that you've never worked in that area before, but that you are really keen to learn, that you're willing to do e-learning and some learning into the area and to be led by others. So you're sort of saying what your weakness is, but then also how you would overcome and manage that weakness. And then a few more interview questions might be, what does being compassionate towards another person mean to you? And and that's about putting yourself in other people's shoes and thinking about their preferences and their individual needs. It's about being kind and respectful and non-judgmental, but have a look into what compassion means to you before your interview. Telling them about a time when you work well in a team, or when you've learned from a challenging situation. So you need to reflect back on your past experiences at school, in a charitable situation, it might be in your home environment situation, or previous roles that you've worked in, and think about examples that you would use before your interview. So finally, some other questions, scenario-based questions you might be asked according to the area that you're going to be you've applied for. So some example ones might be, you saw another member of staff shout at a patient, what would you do? Now that is unacceptable, and you should always report and escalate to a senior staff member and tell the person not to shout at the patient. But there will be escalation policies and guidelines that you can follow. If a client was verbally aggressive to you, if they're confused with dementia, that would be very different to somebody that's not confused, for example. So it's being kind and compassionate to somebody that has dementia or that's confused. But if somebody was verbally aggressive, it may be that they're really stressed about the situation. So you have to look at it within the context. And there's different levels of verbal aggression. Someone might just be a bit abrupt with you and raise their voice slightly. It's very different to someone shouting and swearing at you, which isn't acceptable. And there is policies in all institutions will have policies regarding that. But it's something you need to think about and read around as well. But always escalate to your seniors. You might find somebody on the floor not breathing, and we would ring the emergency buzzer, call for help. When you start a role, you would be given basic life support where we look at airway, breathing, circulation. But if you've never worked in healthcare before, they wouldn't expect you to know that, but that you would escalate, run and get help. And if you have worked in a healthcare environment before, you could say about the basic life support, or that you'd be having that training. If a patient told you that they didn't want a wash today, you wouldn't force them to have a wash. You need to be kind, patient-centred, but it might be that they need a really sort of compassionate approach, that you get to know them and encourage them and enable them to have that wash. So looking at the strategies that you might use if somebody said they didn't want a wash that day. You might visit a client in their home and they say they can't cope with life and they don't want to go on anymore. And again, it's listening, it's using your listening skills, being really patient, spending time and being with that person, but escalating to a senior nurse to try and have some strategies to help support that person, because they may be at risk with their mental health and their mental health might have deteriorated. So there may be other scenario-based type questions that you want to think about depending on the role that you're going for. Dealing with nerves. It's normal to feel nervous before, during an interview, and this is the same when you're an experienced nurse too. So interviewers always expect this. So let the interviewers know if you're excessively nervous so they can support you. And remember, you've done really well securing your interview, and you can ask for more time to answer a question if needed, or if you're not quite sure what they've asked you, what the question means, then you can ask for clarification. So don't be frightened to do that in an interview. So good luck with your interviews. Do let me know how you get on. If you've got any questions at all, let me know in the YouTube comments, or if you prefer to DM me, you can DM me on Twitter or Instagram. But I wish you every success with your interview, and I hope you found this talk helpful.